Right, then let's revisit that health story that we started with at the top of the hour. Here in Nairobi, delegates from Eastern and Central Africa have gathered to discuss funding for anti-malaria initiatives in their respective states. During the 2025 End Malaria Councils and Funds Chairs meeting, leaders and delegates reaffirmed the commitment to try and close the malaria funding gap by raising the resources they need in the domestic market. Leaders are expected to raise an estimated $6.3 billion a year. That's the amount of money needed to sustain and expand malaria control efforts. For context, that's about half of what Google made in its cloud business in the last quarter of 2024. So where will this money be found? Let's discuss this further with Joy Phumaphi. She's the Executive Secretary of the African Leaders Malaria Vaccine Program, joining us here in Nairobi. Joy, thank you for your time this evening. Let's start with that freeze on foreign aid spending by the United States. Can you give us a sense of how that's affected efforts to deal with malaria, like the Malaria Vaccine Development Program?
The freeze is not just affecting USAID, it affects USAID, of course, which means that it's going to affect the US President's Malaria Initiative, but it is also going to affect money that USAID gives as direct support to countries, as well as the funding of organizations like the World Health Organization, which a lot of countries rely on for technical guidance and technical support. Is also going to affect the replenishment of the Global Fund, the replenishment of Gavi, that is the Global Alliance for Vaccines. So we are not just talking about vaccines for malaria prevention, but we are talking about the long-lasting insecticide-treated nets. We are talking about a reduction in indoor residual spraying, access to rapid diagnosis tests, and to treatment as well for people who are suffering from malaria. And appreciating that the people whose lives we are trying to save here are primarily children and pregnant women. Those are the ones who are dying in large numbers from malaria. So these are the people who are going to be impacted.
I want to narrow it down to three countries that have been doing some interesting things on the vaccine front: Ghana, Kenya, Malawi. They've vaccinated at least 2 million children through a malaria vaccine since 2019. On that measure alone, can these three countries be able to cover the cost of deploying that vaccine by themselves with their own domestic resources?
Certainly not, because the cost of this malaria vaccine is actually equivalent to all of the EPI, that is the vaccine program for all vaccine preventable diseases. So it is extremely expensive, because this is the first in a series. We are expecting the next class of vaccines to be a bit more affordable. So this one is extremely expensive. And definitely countries will not be able to afford to continue to vaccinate their children.
When we say it's going to be extremely expensive, can you give us a sense of the numbers that we're talking about here?
Numbers meaning the amount?
Yes, please.
The vaccine costs over $30 per child. And for most of our countries, that is the cost of all the vaccines that a child needs to have, a child under the age of 5 needs to have.
Right, okay. So $30 a child, if you're multiplying that across 10, 20 million children, the cost does add up relatively quickly. And we're not even, I presume in that number, we're not talking about cost of logistics, storage, the price of essentially having staff to actually administer the vaccine as well.
Absolutely. And the vaccine cannot be administered on its own. You still need to have the child sleep under a net, and you still need the mother still needs a prophylaxis when she's pregnant. And so it's not as if when you vaccinate, it resolves everything. And there's only children of a certain age, babies of a certain age, that can be vaccinated. So most of the babies older than a certain age cannot be vaccinated.
Indeed.
So it's a small population cohort that can be vaccinated. So really, we cannot just focus on the fact that children will not be vaccinated, but we have to focus on the fact that children will not be able to sleep under nets. Children will not be able to sleep under rooms where indoor residual spraying has been done, and there will be no early detection and access to treatment.
Indeed. One last question for you, because heads of state will be meeting in Addis Ababa from next week, later on next week at the AU Heads of State Summit. What's your message to them? What do they need to do from where you stand as a policymaker to end this reliance on non-African taxpayers to cover the cost of health research and deploying treatments for diseases that where the disease burden really has been here in Africa?
Well, we are meeting today here in Kenya with captains of industry from several countries around the continent. And these captains of industry are working with partnering with governments to actually mobilize resources in the fight against malaria. And they were mobilizing them at a time when we were not yet aware of this budget cut. But it's now very, very clear that they have to mobilize more resources. So the call on the African heads of state and government when they meet in Addis, which is going to be coming from the chair of AMA, both the incoming chair and the outgoing chair, will be to increase budget allocation and to ensure that they bring in the private sector into the fight against malaria, and to also appreciate that malaria is a multi-sectoral disease. So you shouldn't just have the health alone fighting this disease. Environmental ministries, ministries of agriculture, ministries of forestry, all the ministries that deal with climate change, in fact, should be fighting malaria together with the Ministry of Health, which means that they should also budget for vector control interventions in their own ministries, particularly where like in the agricultural sector, rice paddies, for example, are ideal breeding sites. So if you are going to be planting rice, growing rice in the agricultural sector, you should factor in budget for larviciding. Ministries of Environment should budget for larviciding.
Right.
Mines, minerals, they should have the responsibility of protecting their workers from malaria through nets and through indoor residual spraying and through access to test kits and treatment. So we have to share this burden and this responsibility for controlling malaria throughout the government sector, and not just leave it with the Ministry of Health.